Welcome, everybody. Thanks for joining us tonight.
Gracias por estar con nosotros esta noche.
I'm going to put Miss Liliana on interpreter. I apologize. I did not do that earlier, Miss Liliana. Okay, I think we've got our interpreter turned on. All right, thank you. Good evening. Thank you for joining us. We're going to give it just a minute or two while people hop on. If anybody needs interpretation, it's going to be the translation that looks like the globe. If you don't need translation, I would still click on it and click on English in case we get any questions in Spanish that would need to be interpreted. So welcome, welcome. I'm going to ask if somebody could test out the chat for me. We were having some trouble with it last presentation, and we think we fixed it. If not, please feel free to put your questions or comments in the Q&A because we want to make this as interactive as possible. I have a few questions to start with our speaker tonight, but we would love to hear from everybody. If you have questions, feel free to type them in the Q&A and we'll see if we can get them answered tonight. Thank you. Chat still says it's disabled. Thank you so much for testing that out. Okay, so we did not get it fixed, but thanks for letting me know. So again, use the Q&A function. If you guys want to put any comments or questions, and I know we only have an hour tonight, so I'm going to go ahead and get started. I know we'll have more people joining us. We are recording this, so it'll be available on our YouTube channel. Tonight, I'm especially excited because it's somebody I consider a friend and a mentor for many years. He's still teaching me. I still have a lot to learn. I think you guys are in for a treat. My name is Beth Burt. I am the executive director of the Autism Society, but just as important or more important, I have two wonderful sons, one who has autism and another who has behavioral health disorders. And I'm privileged enough to be their mom, and it's been a wonderful journey filled with some bumps and lots of things to celebrate along the way, but it's taken a lot of people to help us get to where we are today. So I'm grateful for all of you for joining us tonight. With us is Marty Omoto. He is a nationally respected disability rights advocate. He is the executive director of CDCAN, which is the California Disability Community Action Network. And he would say, more importantly, or just as importantly, he is a brother and a father of Alex now. And I'm thinking he's trying to get Alex to come by and say hi to everybody. Yep. See, I knew. Oh, there he is. Hey, Alex, how are you? Oh, we can't hear you. You're on mute.
Thank you.
Okay, I'm fine. How about you?
Good. It's nice to see you. Thanks for coming over to say hi.
We're going to say hi to people who joined us, okay?
Okay.
And I just wanted to invite Alex just to say hi. He's doing important things. He's playing games, video games.
Well, that is very important. It was nice seeing you, Alex.
You too.
So I will let Marty talk a little bit about himself and how he got there. And that actually was one of my first questions was, let's talk about your inspiration, Marty. You have been in this business for decades, I would say proudly. But what is your inspiration? Why have you dedicated your life to advocacy for not just our community, but the underserved communities?
So I think it's the same for a lot of people, especially if you're a family member or a parent. And that was the case for me. My older sister, she was 2 years older than me, had developmental disabilities and was on the spectrum. And so it's when I went to school with her. I didn't go to grade school with her, but I went to junior high school. I was the only sibling out of seven who went to school with her. So I'm the only one who would actually see things and see how she was treated in special ed. No one else in my family, my parents didn't see what I saw. And when I started, my family treated her like all my other siblings. She was a part of the family. She participated in everything that we did. So I just thought the world would do the same. Little did I know in junior high school, my first day there, is that the world didn't treat her the same. And I began to see abuses, how she and the others in special ed were being treated and made fun of, and nobody did anything. The teachers didn't do anything. And so that's when I decided to become an advocate, that I needed to stand up and say, do something, or simply allow it to happen. And so that was a long time ago and continued forward. I carried that until she passed away in 2003. All the things she needed, um, gave me a sense of urgency to fight for the things that we need. And so I connect with the families who feel the same way, or the individuals with disabilities who feel a sense of urgency when they need a service or they need help, that you can't just necessarily wait another year or 10 years when you need help now. And that was the case of my sister. And so that's how I got really involved. The other thing that kind of was a lantern in terms of shedding a light on my advocacy was the fact that my family is Japanese American, and my entire family, my parents, my grandparents, aunts and uncles, were all taken from their homes during World War II simply because of their race and put in internment camps in the worst parts, deserts in the United States, for 4 years. And simply because they're Japanese American. And that stayed with me, that injustice and the fact that good people stood by and watched that happen. And so that's the other thing that carried me forward in terms of my advocacy about making sure that people aren't mistreated and that we fight for everyone's rights. Little did I know that going forward to 2026, 2025, that we would see almost the same thing happening again. And it's just amazing and tragic. A couple of years ago, when Alex was 25, he's 33 now, his mom died. She was a close friend. They had no family. And while she was in the hospital, she begged me, pleaded with me to take Alex, because they had no family. And as she was dying, I didn't give her an answer. It's because I didn't know if I could say yes. And then I finally realized the only reason why she was hanging on to life is because she was waiting for me to say yes. And when I realized that, I said, yes, I will take care of Alex. So she died in 2018, and Alex has been with me ever since. And I didn't think if that would be possible, that that I'd be a father again. I have 4 other children, but you never know what your life is going to end up being. And so to the families or to the people who are on, you can plan all you want. And you know this, if you have a person with special needs in your family, you can plan all you want, but 10 years, 20 years, 30 years down the road, something unexpected will come into your life. And it will at first seem like a burden or a responsibility that you may not be able to meet. And then sometimes you realize you don't have a choice. And then when you realize that, because the other option for Alex is that he'd end up in a group home with strangers for the rest of his life. And so there was no choice, but there was a choice. And Alex and I both took it. And since then, I cannot believe a day that Alex would not be in my life and vice versa. So, you never know how things work out. And it hasn't been easy, but, and Alex keeps me going in terms of fighting for the things that all of us need because it's real. If he doesn't get his Medi-Cal, if he doesn't get the help and supports he needs, something happens. So I appreciate you giving me the time to mention it because I think we all are here and we need to kind of link up, like, why are we here and why do we care? And how do we're going to have our bad days, and then how do we help each other out? Not just talk about policy or what's going on, but also how do we give each other the strength that we're going to need? And by the way, so many friends, including you, and others over the years gave me that strength when things were very difficult, when I had Alex initially, because it was hard. And I will always be thankful for that.
Well, thank you. And I feel the same about you. I would say there are a few things that set you apart from other advocacy organizations or other people's just advocacy, philosophies maybe. And one of the things that I love that you say is it's not just about person-centered. You live the person-centered advocacy. Can you talk a little bit about the difference of why that matters and how centering, Alex or somebody in the middle of whether it's a question to a policymaker or your IPP or your IEP, whatever the acronyms are, why does that matter that we aren't getting caught up in, 10% more rates for everybody versus what is it that my loved one needs?
So you said it. I think ultimately, person-centered or whole person-centered, meaning look at the individual's complete life, Alex's complete life, and what is it that he needs? What is it that he uses now? And then in the future years, what is it that he will need? And what is it that the state is proposing or is doing or not doing that's going to impact those things? And what is it that Congress, currently controlled by Republicans and the Republican administration, what is it they're doing? For instance, the big cuts they made last July. How will all those impact my son's life ultimately? And so we need to bring it home. All these changes and ideas and proposals, we can talk about it broadly that they're going to make a $200 million cut or $2 billion cut or whatever it is, or they're going to, cut IHSS and they're not. But let's say if there was a proposal, we need to bring it home. What does it mean in my home if that happens? If I have IHSS, is my IHSS going to be okay for my daughter or my son or my, whoever it is? Will my person who provides the services be safe? Will they have a home? If rents are going up and there's no way that the state is helping to control that. And I think that's what we need to do is bring it home to where we are so that everyone understands. And also, by the way, so that people in Sacramento, the legislators, the people who represent you, understand that when they vote on something, it's not just talking about human lives that are impacted, because they all do that, and they're all good people generally. But we need to tell them how will it impact the people like who are on this webinar right now, and the others who will listen in the coming days. How will that particular policy change or budget cut help or hurt my daughter or my son specifically? Like if you cut this means my son won't be able to get the employment services that he uses right now or the ABA services. And we need to speak to it in that way because otherwise, legislators, again, generally good people, are going to vote on things that they're not totally understanding the impact. And so I think that's what person-centered means, is bringing it home. By the way, the other thing is I say whole person. A lot of people aren't familiar with that term, whole person. What that means is if you look at any of us right now in this webinar and those who are listening later, you don't, it's looking at like I have 4 other kids besides Alex, and their life includes a lot more than just the things that I have provided to them or see. Alex gets regional center services, but he also gets Medi-Cal. He depends on public transportation. We use Uber and Lyft. He needs housing. He needs food. He needs behavioral health services. And I think that's the point, is that we need to look at all those things to the people in our community, the workers, as well as to our families. And then look at then is there anything in the state budget or the federal budget or whatever Congress is doing or not doing that's going to impact any of those things? So it's important that we make sure that we talk about things in that way, because if we don't, what's going to happen is legislators, again, good people, are going to think the regional centers take care of everything that we need. So if we don't cut the regional centers very much, then all of you should be fine if you're getting regional center services, when we know that's not true. And by the way, a lot of people who get regional center services, especially if their kids are children, they're not adults, they're under the age of 22, they are getting or maybe getting special ed services. And that's not through the regional center. They may be getting county mental health services. Again, that's not through the regional center. And if we shortchange our children or our families by only talking about what they get from only one system, that's not talking about the life of your children or yourself or the people who you provide services to.
Marty, I think you're being humble, because I think it was during the recession in 2008, you actually had to say that to legislators, because they didn't realize that they were, what we could call almost stacking cuts, because they were thinking, oh, we're going to go a little over here in special education and a little over here in IHSS and a little bit here in regional center, and not realizing that's that same family. So you've continued to cut Medi-Cal and all of this stuff. And you spoke that truth because nobody else was saying that at that time.
Yeah. It's funny. We think that people understand how everything works. And the reality is, is that most people don't. They understand what they know or lived. And if they haven't lived the lives that we live, then they're not going to necessarily know unless someone helps to teach them or talk with them so they become more aware. Back in 2003, when Arnold Schwarzenegger, he actually ended up being not a bad governor, but in his initial days, he hired some people who took actions that were really harmful to our community. One of them was the Department of Finance director. And one of the proposals was, for the first time ever, to suspend the Lanterman Act, which is we're the only state in the country that has a specific state law that protects the rights of people with developmental disabilities. And it was passed way back in 1969 by a Republican assemblyman who authored a bill and signed by then Governor Ronald Reagan. And it had been in existence since that time, 1969. And Governor Schwarzenegger, under his proposal, would have suspended it. In other words, he would have capped it so that nobody else who was eligible could come into the Lanterman Act and create basically a waiting list. And we launched, there's a couple of things we could have done. We could have done nothing. Or we could decide to launch protests to force the governor to rescind that proposal. And we did. We launched massive protests. There were thousands who came to the state capitol in December. It was cold, 6,000 at the Capitol. And within a day or two, Governor Schwarzenegger rescinded that proposal to suspend the Lanterman Act. And they never tried since then to try to do that. But it does sometimes take all of us to act and not depend that someone else is going to do it for us. But when we think back that could have happened, we could have had a Lanterman Act that basically was capped and that someone would have to die for another person to get services, because that's how a waiting list works. And so that almost happened, but it didn't. And it didn't because, a good person in the administration at that point in time thought better of it. It's because our community across the state took action. And by the way, they weren't lobbyists. They were family members who never came to Sacramento before. Actually, several in your area that came up. And I just think we got to remember that there's power in our communities. And we saw it in Minneapolis, and we saw it in other parts of this country on different issues, that there's a power there. Can't use it all the time, but there's a power there, and we can win. We can prevail. So
One more point, and then we can jump into some of the policy. And it was something that you helped me realize. And then I heard an employee talk about it. And sometimes as families, we get stuck in, our loved ones. And really, it needs to be broader than that. It needs to be about the people who, are the direct care providers, all of that. We all together are a community. And I was at a friend's house, and it was a direct service provider who asked if he could sleep in her driveway because he had 3 jobs and he was just exhausted. And he said, "Do you mind if I just took an hour nap?" And I mean, that really opened my eyes that yes, as family members, we have our struggles, but we can't close our eyes to the direct service providers as well, who are going through their own struggles often.
I think that's always an important thing to remind ourselves, and also how we refer to a person who's providing a service. And I will always call them a person or people who are providing the services, and not, oh, they're providers or they're this, or we're beneficiaries, right, of Social Security, or we're a Medi-Cal recipient. My son's a person, and so am I. And I was a direct care worker back in the 70s here in Sacramento, working with people with developmental disabilities in a program. And I think it's recognizing, it's not giving them anything that they don't already have. It's recognizing something they do have, which is the right to be treated with dignity, everyone. And so that right doesn't stop with my son because he has a diagnosis that makes him eligible for services under the Lanterman Act. That doesn't give my son more rights to being treated with dignity than someone else. It gives him as many rights or equal to anyone else. But one of the things I've always done, and I did it with my sister, and I did it all the way through my career, is is demanding, not even asking, demanding that people treat everyone with respect. So you treat the person who's providing the service with respect. You not as a servant. And that's one of the things I had to work with Alex around with when he first moved in with me, because he wasn't conditioned to do that. That you do say thank you when someone helps you. You do acknowledge a person, when they do something for you. You do say thank you to the Lyft driver. But he didn't do that at first. And I think, and that's no reflection on the way he was raised. It's just that we're conditioned to think that a person with a disability or developmental disability, like my sister, is the center of the world and everything should revolve in around that person. They are the most important person ever. So every parent kind of thinks of their own children are the most important children, people in the world. Generally, don't you hate parents who just think that? But aside from that, because you meet them at PTAs and those kinds of things. But beyond that is working with your families, but also I work with Alex so that he understood that everyone's important. And so now he says thank you without me telling him to. He says thank you to the Starbucks people. He makes sure that he leaves a tip. He does that on his own. And but the reverse is not him doing that he doesn't get anything back. What he gets back is the respect from them as a human being. And by the way, a human being that I don't even go into Starbucks with them when that transaction happens, when they respect each other in that way. I stay outside and I can watch. And I think that's so important. And the reason also is recognizing, and you mentioned the whole idea about looking at that person who wanted to take a nap in the driveway, is there are so many workers who are not paid enough that they have to have multiple jobs. And we got to remember they have families, or some of these people have families. And so how do you make that happen when you're doing all these other things? And so it's recognizing that person who took a nap in the driveway there is, how do we make that person's life better, so that they can then be a person who can better serve. Because the result would be, if we can make their life better in some way, hopefully it then will mean that they can then, be able to provide a better service to your son or daughter. Though it shouldn't only be for that reason, that payoff. It should be for the reason that's the right thing to do. But when we recognize that everyone has a need, everyone deserves respect, we don't lose anything by doing that. My son, Alex, doesn't lose his importance to the state of California or to me or to anyone else. If anything, by recognizing the value of other people, it's enhancing his importance as well as everyone else's. So I'm glad you raised that, because in our advocacy, as we're talking about policy changes in the coming months, we got to think of our total community, which includes our families, individuals who receive services, the families who may be around that individual, though not every individual has a family around them, and then the people who provide the services.
Right. Let's get into some policy. A conversation you and I have had about our remote services. During COVID, remote services helped many, not all, of our community. Do you think these options are going to stay, expand, or shrink in the coming years?
It's a good question. Initially, there were some services that the remote services were looked upon as being very useful and were made permanent. So in the area of early start, a lot of those services can be done remotely. And that was made permanent. What hadn't been made permanent, though, is many of the other services that were temporarily allowed to be remote due to COVID. A lot of them are day programs, and services like that. Uh, and there'd been a big push by many of us for the state to make those permanent. That it's not just a lesser option to provide services; it's a different option that families or an individual with disabilities may want to choose, just like everybody else. Like anybody else, depending on their job, doesn't matter if they're disabled or not. They may have a job that actually they can work remotely. It doesn't mean they're doing less of a job, and or they can receive a service remotely, meaning healthcare. And I think we were all of us successful in getting the state of California to push that forward. So the Department of Developmental Services, through the Newsom administration, is advancing a proposal in the budget, in the current budget that the legislature is considering to make remote services, a series of different services, permanent. And these are regional center funded services, permanent. Um, you know, with as part of the budget. And so to answer your question, to those people who want those things, they should be happy that that's happening. One word of caution, though, is I would make sure that if you're getting a remote service or a certain remote service that you would want, make absolutely sure, though, that that's being covered in the budget, because they do list specific services that are covered under state law or state regulations. And I know that some of us have asked the state to make a modification to their proposal so that it doesn't inadvertently exclude a service that many of you are getting remotely. And we'll see what happens on that. So, but that's a good question, because that's a question where right now the policy is being developed. It's going to happen, and we got to make sure that that it will be implemented in a way that doesn't take away a service. And also, I would ask people, your audience, to those who are on now, but also those listening later, how can we improve remote services, or what are the other things that aren't listed? Are there other things that could be done remotely that we haven't thought of? And there's a lot of elements of independent living, for instance, that 10 years ago no one would have thought that could be done remotely. And I think as time goes on, we as advocates, we as family members, all of us need to kind of think, how can we change things up a little bit?
I think one of the examples you shared with me was a cooking class, right?
Yeah.
10 years ago, we would have oh no, you would have had to been in person. But now, how many of us go to YouTube and look at cooking or piano or whatever it might be? There are so many options out there that have just become normalized through video that we wouldn't have thought of 10 years ago.
I had a discussion on that because I feel exactly the same way, that those are great things for us to have access to in terms of information. But I remember talking to a senior official at the Department of Developmental Services. So that's the department that oversees the regional center system, that oversees the services that, if you're a person with developmental disabilities, the department oversees that. And again, this is a really good person who I was talking to. But his point was, he was worried that, oh, well, if we do too much remote, that will mean, that a person's going to not have contact with a human being. And, that's not necessarily good, that they need, interaction with the human being. And I just flatly told him, what makes you think that my family needs you? And I said that in the nicest way possible, to be the person that interacts with my son in person. You don't think my son and myself and everyone else goes out and does things and meet people that have nothing to do with the regional center system. And I said, let's not think that the only way that we interact with the world must be through the system that they're responsible for. So give us the tools that allow us some flexibility, like remote services, so that we can meet people, but we don't need you to help us meet those people. And maybe we do. Some people might need that help. And again, he said this in the most kindest way. I don't know for sure if I answered it in the most kindest way, but you know how family members get, you know how dads get, right? So,
One of those truth bombs, I think.
no, as soon
All
as I
right,
said it.
let's go. We're gonna go big. So let's go to the federal government. I know I will say many families, including myself, feel overwhelmed by the speed and amount of policy decisions that have happened during this administration. There's been lawsuits, there's been things that have happened and then have been cut back. And can you kind of tell us, like, I know there's a lot out there, but maybe give us the three big things as and if you were talking to me, I'm a mom of a son with autism. Um, and we'll put aside the behavioral health right now. We'll go back to that a little bit later. But what would be some of the big things that I would need to know or keep my eye on in the next 6 months?
So one of the big things that Congress did, which is controlled by Republicans currently, was a very controversial federal bill, HR1, which is known as the One Big Beautiful Bill. And in that bill, it contained almost $1 trillion, not quite $1 trillion, but almost, of cuts to Medicaid. Medicaid is the name nationally that in California we call Medi-Cal. And that's the federal money that the state matches up to provide Medi-Cal services here in California. And Congress, put in HR1 a lot of changes, policy changes to Medicaid, also some outright cuts that are going to impact people's lives. The question, though, is, will it impact, let's say, in response to your question, your son's life? And will it impact the other people who are listening in right now? And the answer is, it really depends. If your son or daughter or friend or whoever it is that you're speaking about receives SSI and therefore are eligible for Medi-Cal because they're SSI, they are largely exempt from those cuts in HR1 in terms of Medicaid. However, if they're getting Medi-Cal in California because of something called, because of the expanded eligibility under the Affordable Care Act. Affordable Care Act is also known as Obamacare back in 2013. But if they did get that, so in other words, they are eligible for Medi-Cal, the expanded version of it, not because they're eligible for SSI, but because Obamacare, the Affordable Care Act, allowed them to become eligible. If you're in that group within California, then many of the changes could apply to you. So it could apply to your son if that's how he's getting his Medi-Cal. And so if you fall under that group, and again, there are exemptions, there are new rules that will go into effect next year that include work requirements or community engagement, meaning you have to work or be engaged in the community so many hours to maintain your eligibility. The state of California has issued an implementation plan to the public and to the counties. It's not totally final yet, but that will help a lot of you. And I'll make sure that you get the link to that information. The second thing is something called redeterminations or reassessments. Again, for that same population where the state's going to be required to reassess someone's eligibility. Normally it's every 12 months. It will be every 6 months. And so the state will be issuing guidelines. Actually, they issued some guidelines already about how they intend to implement that. Again, these aren't things the state wanted to do. This is coming from Congress. And people are going to lose their eligibility for Medi-Cal because if they don't respond to the assessment because let's say they moved or they don't have the right paperwork or whatever reason, they could lose eligibility. They could lose eligibility if they don't have the right number of work hours or the right type of employment or community engagement. So that's on the Medi-Cal side. Again, if you're eligible for SSI, so my son Alex would be exempt from those cuts because he's eligible for Medi-Cal because of his SSI eligibility. The other thing to be worried about or concerned, and again, it has nothing to do with Medicaid, is the cuts or changes to the Supplemental Nutritional Assistance Program, SNAP. In California, it's known as CalFresh, and that's the food assistance program. And the federal government, as part of HR 1 against that bill, that same bill had a provision there to cut funding to the states if their error rate, meaning if the error rate of people who are not eligible for what was used to be known as food stamps reaches a certain point, then the federal government will make a cut. And so the state is really taking steps to making sure that the error rate doesn't allow the federal government to take money away from the state of California. But it could happen, and that would mean, millions, hundreds of millions of dollars potentially that the state could lose. So that one, there has been some guidelines or will be additional guidelines listed out. Those are the two big ones there. There's also a cut to Medicaid that will hurt the state financially. It was not allowing the state of California and other states to get additional Medicaid dollars, something known as a provider tax. And HR 1 more or less prohibits the type of tax or the type of funding that the state of California and other states were able to get. And that's worth billions of dollars. So what that means is at the end of December 2026, which is the current waiver, a waiver is special permission from the federal government to do a certain thing with your Medicaid program. And in this case, it was about getting additional dollars for the Medicaid program in California, and we were getting billions. That expires in December 2026. And there's almost no chance, there's zero chance that will get renewed, which means California has to find a way to replace those dollars somewhere. And so how does that impact any of the people in this webinar or those listening later? It could. If the state's financial situation becomes worse over the next couple of years and therefore has less dollars to spend, it could mean less money for regional center services or Medi-Cal or housing or whatever. Right now, we don't know the impact, so we don't want to panic anybody, but we're going to lose billions of dollars by the end of next year because of HR1. And so there's that. Separate from HR1, there are changes being imposed by federal agencies, HUD, which deals with housing, transportation, and also by the agency that oversees Medicaid and Medicare, called it's referred to as CMS, or the Centers for Medicare and Medicaid Services. And they just issued some guidance and warnings to the state, a press release that warned the states, and they're targeting the blue states, like Minnesota, but also California and several other states, that they will be pushing investigations for fraud, abuse in those states' Medicaid programs. And so what does that mean? Right now, nothing yet to California, but definitely in Minnesota. And again, Minnesota was a hotbed of a lot of the protests against the ICE enforcement in Minneapolis. The federal government just today released a press release, or announcement by J.D. Vance, the vice president, that they're going to withhold it. Currently, they're going to withhold $250 million of Medicaid payments that owed to the state. And that could eventually rise to $1 billion, accusing the state of not complying with taking the measures to combat fraud in the Medicaid program in the state of Minnesota. The governor has refuted those charges, but we'll see where that goes. Well, similarly, the federal government is making accusations, but they have not taken any action yet against California. So again, this is separate from HR1, that we have to be vigilant as a community to look at how do we respond as a community across the state if the federal government tries to withhold Medicaid dollars. Actually, it's not just Medicaid. It could be dollars for housing. It could be transportation money. It could be money to education. How do we stand up to those things? In some of those instances, the Attorney General of California and other attorney generals have filed lawsuits. And in many cases, they've stopped those withholding of funds that the state of California and the other states are owed. So the problem with all that, though, it gets very confusing, because you can read in the newspaper, the old newspaper, you could read, on the internet, or catch, however you get your news, that, a federal court has ruled in favor of the state of California, and they blocked a cut, or they blocked the federal government from doing something, withholding payments. But then the next day, the appeals court changes that. And so we're kind of left in the state of being confused of what's going on, what's happening. And so the answer is, how do we get clarification? It's not easy, because we've never been in a situation like this where there's like constant chaos, but that's by design. And because that's by design, as advocates, we have to really, really be calm and decide to pick and choose our battles, but we really need to be vigilant and stand up, because it's not just some remote thing regarding funding for, more Medicaid dollars for the state. Those dollars translate into money that pays for something that your son or daughter needs. So it's not just something, that's in Sacramento. It's actually dollars that are paying for something that our families need. And is that worth fighting for? I think so. I mean, in a way, I go back to when I was a junior high school student. The fact that my sister was likely being abused in special ed for a couple of years before I went to school with her. But it didn't become personal for me until I went to school with her and saw it. And so if you know that this is personal to you, that cut could impact your son or daughter's life, or if you're an individual receiving services, your own life, then you're going to realize the time is now, or it is important for you at that point to decide what are you going to do about it, because it's about you now.
Let's talk just a little bit. I'm watching the time too about California. We only have about 9 minutes left. Is there anything with the California budget that would be particularly damaging for many of the services that our families receive, whether it's IHSS or Medi-Cal or
So
Regional Center?
right now, the budget that Governor Newsom proposed in January doesn't contain any major cuts at all to any of the major programs for people with disabilities or behavioral health needs. So the regional centers, the services under regional centers have largely not been cut. IHSS has not been cut. There are some exceptions, like there's an elimination of the provider backup system. And Medi-Cal has largely not been cut, except for a certain population of people not documented who receive what is known as state-funded Medi-Cal. In other words, the federal government doesn't pay for that. So there are some changes there, but largely everything else has remained intact. Now, what we don't know is when May comes around, the governor by law has to submit a revised budget based on new numbers. And we don't know, because the state's facing ongoing budget deficits of several, like, billions of dollars, maybe up to 30 billion, could be higher. The governor's office disputes that, but we'll see what happens in May, in what the governor proposes. At that point in time, all of us then need to kind of gather and realize how does those proposals that the governor will be proposing in May impact my son or daughter or my friends or or the worker. But again, we won't know that until May. Now, leading up to May, though, between now and then, California is like several other states. We're involved in an election this year. This is the final year of Governor Newsom's time in office. He leaves office next January. He has served for 8 years. So there's an election going on to replace him. He can't run again because of term limits. And there's a June primary, June 2nd, where the top two candidates, it could be two Republicans, it could be two Democrats, or it could be Republican and Democrat. But whoever gets the top two get the most votes will then advance to the November election. And there are several Democrats running, and there's like 2 or 3 or 4 Republicans running. And so everybody who's listening in now should make sure that you're registered to vote and that you do vote in that election, because that will be very, very important. Because the next governor, whoever wins, not in June, but in November, they will take office in January. That person will propose a new budget next year. And that budget will impact the lives of our families. So that's why that's important. The other reason to stay involved on the election side, more so than ever before, is because in November, especially in California, but also in other states, what will be decided is who controls the U.S. House of Representatives and also the U.S. Senate. And right now it seems tilted that the Democrats might get control of the House and maybe even the Senate. Why that matters is because if that happens, that makes further cuts to Medicaid or other programs that we may value, much more difficult for anyone, Republican or Democrat, to propose. So it really does matter who controls Congress. It doesn't mean Republicans are necessarily the bad guys or whatever, but it does mean, that perhaps if another party is in office there, that there more accountability will be put in place. So that's something that's looming before us. That's really, really important.
I'm going to ask if anybody has any questions, throw them in the Q&A as we wrap up. We have a question from Elizabeth, and I'm assuming it's about the remote employment services. Her question is, how can we advocate so that remote employment services continue with Regional Center?
It's a good question because the budget proposal may not specifically point back to that specific program. My guess it probably would continue, but that's not what we need. We need assurances that it will continue, and there's no reason why they can't make that clear. So I would organize, whether it's Autism Society and the Empire, to make sure that a letter is drafted or some letters drafted to the Department of Developmental Services and also to the budget subcommittees, telling them that that clarification needs to be included. Don't ask them that it needs to be included. That it needs to be included because the services to my son or daughter depend on that. So that's a good question. I like it because it really ties back to connecting a policy being made in Sacramento and how that impacts your son or daughter or yourself. That's what you call person-centered advocacy.
There you go. In action, right? Another question. It is too hard to get Social Security now. My son goes to college but struggles. He has Medi-Cal, but I don't think he can be independent. My doctor feels he won't get Social Security because he has autism. He's not disabled enough, in quotes, to get approved. So that is something that we hear often, that just as systems are set up, you have to prove that you are disabled enough to get Social Security, but yet you're trying to help people become independent.
When you're referring to Social Security, you mean SSI?
Yes.
Yeah.
SSDI. Yes.
Or SSDI. So my advice also is to be really clear, because another person listening might give an answer that actually is not even connecting to what question you're asking. But whether it's SSDI or SSI, that's not true. Now it is harder to get a hearing, to meet up with Social Security now than it was. But it is possible. And I think in the old days, so this is where whoever controls Congress but has more of an advantage. But let's say the Democrats take control. So I would advise whoever's asking that question to contact your local member of Congress to help intercede with Social Security. They actually have more clout if the House is run by the party in control. But either way, they're federal officials and they can help intercede. One of the things is whatever training an Autism Society and Inland Empire can give to provide some guidance to individuals on trying to get eligibility, for SSDI or SSI. It's not unlike providing training on how do you meet the redeterminations for Medi-Cal, or how do you meet the work requirements for Medi-Cal so that you maintain eligibility, so that you don't lose eligibility. And I do think those are good things tools that people need to have and also learn. So it's a good question. And it does take training, or it actually is training because the people that you talk to at the Social Security office may not even know. I mean, you're absolutely right that they're going to make a determination based on looking at the individual, like, oh, no, you don't need it. You know,
We have, I'm going to do sneak in one more question, and this one's kind of a long one. What is the best path forward to expand adult services? I know we're talking about cuts today, but I also know former special ed students who were neglected or even abused. The problems they have as kids weren't addressed and they don't just go away. There are newer autism interventions becoming available, but Medi-Cal stops at age 21 for autism treatment.
so that's a really good question, and it goes back to looking at the whole person. So how your family member or yourself, if you're talking about yourself, what can the state of California then do, beyond the services for a child? And the fact is the state of California has pumped in billions of dollars into behavioral health type services. And some of this you're familiar with, Beth, but behavioral health, there's a behavioral health task force that's been established. There's billions of dollars to help communities and individuals with the intervention services and a whole bunch of other community-based services. The problem, though, and going back to person-centered advocacy in action, is it doesn't necessarily mean that just because there's $1 billion in Sacramento and they talk about it, that it somehow reaches down to Inland Empire, into the street and the house where that individual lives. And it doesn't mean that they don't have a right to that money or that right to that service. It just means, our advocacy needs to provide a roadmap so that that money and that help is directed to that family. And I think that's one of the things, is that the answer is yes, there are services. Yes, there are community-based services that did not exist before that is available, and that your son or daughter has a right to. But does that mean by saying that they're going to get it? And the answer is no. And I think that's where we as advocates together, and I'll do my share up here in Sacramento, but definitely I'll work with Autism Society Inland Empire. We got to create that roadmap so the state of California knows how to get to the street and into the home to provide those services to your son or daughter. So that's a good question because, again, on the policy level, there's a lot of good things happening on behavioral health. But, and Beth knows this as well, in a lot of the statewide meetings, they acknowledge that people with autism, that would include my son, are eligible for a lot of these services. But there's this underlying thing or feeling that if you are on the spectrum, you're taken care of by the regional center, or someone else is taking care of you, or it's not a behavioral health issue. And I don't know how people make that determination, but I think of, old stereotypes keep on living. And our job as loud fathers or mothers or family members or brothers and sisters is to break those stereotypes. But I love the question. That's right to person-centered action.
Yeah. And as we wrap, I just want to say, Marty, again, has been such not just a mentor, but to help steer us, the Autism Society Inland Empire, as we are picking our battles with advocacy, because we know we're all tired, right? We can't fight every single battle, especially when we do call for actions. We try to do one a year because we know that we don't have a lot of energy. But adult services, unmet needs is something that Marty's been a huge champion. If I'm not at those meetings, Marty is at, I think, every meeting, but he is not afraid to have our voice up there and talk about unmet needs and talk about services. So, Marty, I don't know if you can see, but big appreciation for you in the chat and all you do for the community. Thank you for this information. Thank you for your time tonight. Thank you all for joining us. And thank you, Ms. Liliana, for her interpretation.
Yeah, definitely. Shout out to the interpreter.
Yeah, she did a great job. So have a great evening and be safe out there. And tell Alex again, thanks for stopping by and visiting us.
Yeah, he's
All
happy.
right.
Thank you
Good
so
night,
much.
everybody. Bye-bye.